Okay. Um, Hello, everyone. Good afternoon, and it's my pleasure to talk to everybody today about what my organisation, the Innovation Agency, has been doing to support both businesses and also our NHS and health and care services in the Northwest Coast. So we look after NHS organisations in the northwest of England. So, and I'm the Associate Director at the Innovation Agency, which is the NHS Academic Health Science Network for the Northwest Coast of England. So I'm going to talk to you a little bit about who we are and what the Academic Health Science Networks do or did, and now we're in this COVID phase. And I'll talk through what we've been doing to support businesses, NHS health and care during the COVID crisis. And I've got some stories, some really interesting stories to tell about just how NHS and agencies and businesses have collaborated to develop solutions really quickly and have been able to work through some of the traditional barriers in order to really speed up, the adoption of essential health and care materials to support frontline NHS and social care in this COVID crisis. And of course, we've got some learnings, and I'd like to share some learnings as well about what we've learned along the way and what we need to do differently going forward. And that's been a recurring theme through all of the presentations today around legacy and sustainability and so on. And I'll touch on that. So this is a busy slide, but if I can just summarise it very, very quickly, the Innovation Agency is one of 15 academic health science networks that cover the NHS in England. We're the Northwest Coast Academic Health Science Network. And what are we? Well, we're catalysts for innovation and transformation across health and care. Now, we're funded nationally to deliver work in our region. And we've got multiple funders actually who ask us to do work on their behalf. So NHS England and NHS Improvement commission us to do work around patient safety and also programs around products and communities of practice for rapid uptake, which I'll talk about. We've got Office for Life Sciences, which are commissioning us to support businesses with market access to the NHS. And you'll notice that we also have funding from the European Union, and I think it was Ian mentioned the EIT Health. So we've got programs, European Regional Development programs, where we're doing business support for health and life sciences businesses across our region. And we're also heavily involved with EIT Health, even though technically we're outside of the EU now with the Bridgehead programme and the Bridgehead Global programme as well. So a little bit about who funds us and who asks us to do things. And in terms of what we do, if I could summarise, our role is around improving health, driving down the cost of care, and in stimulating economic growth, because if we help health and life sciences businesses to access the large NHS market, then they can grow, recruit people, and patients can benefit from the innovation products that they offer up and eventually are purchased by the NHS. And another busy slide, but I just want to explain a little bit more about what we do. So the NHS is a fantastic organisation that I am very proud to work for. But as we've heard, it takes a long time for the NHS to do things differently, to adopt new technologies and innovation. And actually, one eminent NHS person, Lord Aradarzi, he often is heard to say that it takes 17 years for the NHS to take something that is new and available into full practice. 17 years for an innovation to become business as usual. So that's the role of the Innovation Agency and its sister organisations, is to shorten that time considerably, because we now live in a digital world and we can't wait 17 years for the technology to be adopted. So the NHS needs help in learning how to do things differently, and that's really what the Academic Health Science Networks, the Innovation Agency, do. And we support it in many different ways. Communities of practice and individual products through national programs and through funded programs that allow the NHS organisations to acquire technology, products, innovation, digital platforms at zero cost. And that's facilitated by the Academic Health Science Network. So some examples here. So we've got examples in cardiovascular disease, in gastrointestinal disease, in neurology, in urology, and in obs and gynae, and also in respiratory disease. So those are individual products that are supported, whose adoption is supported across the NHS by the Academic Health Science Networks. And then we've got national programs around communities of practice. And these are just some of those in pain management, in atrial fibrillation, in ADHD, eating disorders, and there are others as well. And let me talk about the work that we do to support economic growth. So this is where we support businesses local to us in the northwest coast of England, and we've had a measurable impact on their economic growth in terms of creating jobs and securing investment for these organisations, as well as helping the NHS providers reduce costs and improve care. And in our last reporting period, we secured over £8 million worth of new investment for our businesses that we supported. They achieved £2.5 million worth of new contracts, and because of their access to the NHS market that we helped them with, they created 73 new jobs. So that summarises a little bit about what we do. But that was the day job. Until COVID-19, that was the day job. And now we've got lockdown. And I'm going to talk a little bit about Dr. Ian Hennessy here. He's a consultant paediatric surgeon and director of innovation at Alderhay Children's Hospital in Liverpool. When the coronavirus came along, we obviously, all of us, as we talked about today, had to adopt a new normal. And to quote Ian Hennessy, we achieved 5 years of digital transformation in 5 days at Alderhay Hospital. And that's something that Richard talked about, and Margaret as well, and Jon and Liz as well. You know, we've really shown what's possible. So let me tell you some stories about some of the achievements. So this slide is entitled, "Why weren't we doing this before?" So as we know, lockdown meant that we had to implement social distancing, and remote consultation therefore was an absolutely essential tool that we needed to adopt in order to continue to provide health and care, particularly in primary care and also in secondary care. Now, we've heard from Margaret already about their experience of adopting at scale in Scotland. And so I won't talk so much about it, but if I can tell you that, you know, if Richard has told us at the start that video technology, video consultation technology it's been around for ages, 10, 15 years, and yet the default way in which the NHS sees people is face-to-face. We do stuff with our hands and not remotely. The COVID-19 crisis has been a real catalyst for change. But as ever, things move slowly in the NHS. I mentioned 17 years before, and so what the NHS did through its command and control decision making was that they created in England a national procurement of 2 platforms, so Attend Anywhere for secondary care and AccuRx in primary care. So video consultation, remote consultation platforms, and that was done in less than 4 weeks, which is an unbelievable achievement. The Academic Health Science Network, so my organisation, supported the initial review of platforms, but NHSX led on the decision in the procurement because that's their expertise and responsibility. In terms of supporting locally our NHS organisations, we helped with options appraisals. But also we offered loan staff to support the rollout and training of these platforms for those that weren't using them already. And now there's almost total adoption of remote consultation across the northwest coast. And I've been on teleconferences and video conferences with primary care and secondary care colleagues from our region who are saying to themselves, why weren't we doing this before? And we're not going back. So hopefully that's some good that will come out of this crisis. I also must also stress that there is potentially a better patient experience here if you can see a doctor at a time and a place more convenient to you through remote consultation. We mustn't forget that. So let me move on to a company called 3D Life Prints. Liz Ashell-Payne will know this company really, really well. They are based in at Alderhay. They have a base at Alderhay. Their expertise is actually in creating 3D printed anatomical models of internal organs. for surgeons to practice operations on prior to operating on a patient themselves. And what that does in usual practice is it helps surgeons basically make fewer mistakes and to complete operations more quickly at lower risk. And a reduced time, so reduced anaesthesia for the patients that they're operating on, and that's been really successful. You saw a picture of Ian Hennessy before from Alder Hey, and he realised that actually if we're going to try and protect frontline workers in the NHS, we need to make sure that we prevent them or give them a way of not touching surfaces unnecessarily. So doors are common touch surfaces. And so between himself and the team at 3D Life Prints, they came up with what they're calling it the infection control. It's the distancer. You can see that the unit cost is reasonable, and actually, if you can see from the diagrams here, it's where you'd put your name badge, your security card. And basically, this is a handle with which you can push doors open or activate electronic door locks. And then this hook here is if you need to pull a door closed or open, then you can do that using this hook, and you don't touch the door, and that improves or reduces the risk of infection. And we've been helping that with procurement and distribution channels and awareness across all of our HSNs, so they can inform their NHS organisations that this exists and can be purchased for staff to buy, and is therefore protected equipment for them. So really interesting, to take existing technology and an idea from a clinician to convert that into something that can protect frontline health workers. So a really great story there. The next one I'd like to talk about is really interesting, and at the start of the COVID crisis, there was a real sort of sense that there might not be enough of certain key things, and protective equipment and infection control equipment, is still a very hot topic. And so a company called Northwest Projects, based in Preston, was asked by clinicians to see if there weren't enough of supplies of PPE masks, standard PPE masks for protection and prevention of infection and cross-contamination, would they be able to manage a solution that could improve the resilience of the supply chain? Would they be able to take developments from existing technology and adapt them for use in health and care? And that's exactly what they did. They took basically scuba masks that you can buy from many sports stores, and they created technology and connectors and valves at the top of them in order to make these suitable for use in hospital and home environments, for CPAP, for infection cross-contamination control for hospital staff, and also for home oxygen users. But there are some key learnings here. So these actually aren't needed now. The social distancing in the UK has meant that the COVID crisis, as bad as it's been, hasn't been as bad as people feared. But these items are ready now if they are needed in the future, and there is a supply issue. This came about through collaboration between trusts, the Innovation Agency, but also universities. But also the mask meets the standard, but there's been limited time to get approval. So how do we get technology like this that's made quickly and hasn't got the time to go through the normal channels of approval, but actually meet the standard? And actually, what this led to was rapid development of indemnities for hospitals or NHS organisations to assume liability and subsume provider liability, meaning that products that meet standard can be made available to frontline staff and patients quickly. And that's also been supported by the government providing easements of equipment meeting specifications, but whose standards have not yet been approved. So really interesting learnings, really interesting story. And there are loads more like this. We've got digital companies that have been supporting the NHS to create contact tracing and symptom signalling apps. Cookson and Clegg is actually a textiles manufacturer, and they're not a digital organisation in the traditional sense, but through their work to create a platform for furloughed seamsters, so people that can sew together garments. They're able to produce now for the NHS in the northwest of England scrubs and gowns and clinical garments at scale, 600,000 a month. And we've been working really hard to help them with the design of their scrubs and gowns, field testing, and procurement. And also companies with remote monitoring. Rinicare developed a COVID pod, so for remote monitoring and supporting the diagnostic effort. And again, you know, we've helped them find opportunities within the NHS to support in the COVID crisis. So I'm coming to my final slide, and it's the learning. So it's what have we learned and what are we still learning? So I think, you know, it goes without saying, businesses have been extremely generous with their offers to support the NHS and health and care. The NHS has really surprised itself and proved to itself that it can move quickly. There's been consistent feedback from the front line from clinicians that that actually the removal of red tape and faster decision making means that care is all about the patient. And surprisingly, it hasn't always felt that way. So there is satisfaction from clinicians at this time. There have been eureka moments. Why weren't we doing this already? And I think a common theme we've heard today is we must not retreat from the gains that have made our health and care service better. So through things like remote consultation and point of care. And I think we move quickly and we make mistakes, but we can learn from them and refine and adapt very, very quickly. The NHS has proved that to itself. So some other learnings and some potential solutions. The supply chain, as many of us have heard, is just not as robust or resilient as anyone thought, especially for non-hospital care organisations in the UK, like care homes or domiciliary care services. And there are some fixes coming for that. NHS supply chain recognise this, and they're developing a marketplace with eBay. But that's not here yet. And the Innovation Agency team are working with NHS digital teams on a clear language processing platform that could help provide a local marketplace that could support local resilience forums to help care homes, nursing homes, domiciliary care, social care, etc., get hold of supplies urgently through creating a local marketplace. So that really is the end of my presentation. I hope that it's been useful for you, and it'd be interesting to hear comments and questions to the panel. Over to you, Andy.